I wanted to take a bit of time to try and outline the position with regard to home working, social distancing, because I know there's a lot of confusion out there. And the bottom line is that this is a rapidly moving situation, and I think my plea would be to, if you could get your heads round at the moment working with a bit of ambiguity, because we're not going to be able to get black and white, yes, no clarity on some of these issues, and the situation may change quite rapidly over the next few days and weeks. So, as things stand, the most important principles are that, number one, we have to maintain essential services across the organisation. The second one is that we've got to put utmost the health and safety of our staff and patients. Wherever possible, we are saying work from home. And to be able to do that, you need to be able to have the kit, you need to be able to log on and do your job as per usual. And there may be some risks attached to that, in that we might not have sufficient kit, we might not have sufficient bandwidth to enable that to run smoothly for everybody all the time, and we may have some teething troubles. There are of course hundreds of different teams across the organisation with lots of different objectives and priorities, and a number that undoubtedly can't work from home. So if you do need to come in either to the office or your clinical teams, think about how you can perhaps expand the day to starting earlier, finishing later, but introducing different rosters and rotas so that not everybody is in at the same time, and wherever possible you can maintain social distancing. And again, we appreciate that you won't be able to do that all the time, but wherever possible, we will support people working at home. And again, there may be some different working practices that you might want to think about introducing, so different ways to do handovers, sit-rep reports. We are introducing Microsoft Teams and other apps that you can download increasingly onto your work phones and, if need be, personal phones, to make that easier. So that's the current situation, but unfortunately I'm going to have to finish by saying that this may change either through this week or next week as the expected numbers of cases in the community and within our staff groups continues to rise, but we will keep you updated as often as possible. Thank you.